Good afternoon, everyone, and welcome to our webinar, Proactive Primary Care, Enhancing the Medicare Annual Wellness Visit with a Team-Based Approach and via Community-Based Events. My name is Cassidy Avila, and I serve as the Marketing and Outreach Coordinator for the Texas A&M Rural and Community Health Institute. Thank you all for taking the time to join us today. We're excited to have you guys on the call with us. Before we get started, I have a couple of housekeeping items to share with you. We do encourage you to submit any questions you have throughout the presentation using the chat feature. We will collect those questions and address them during Q&A at the end of the presentation. And then also, today's webinar is being recorded, and the recording, along with a copy of the presentation slides, will be shared via email within a few days following the webinar. So at this time, it's my pleasure to introduce the three speakers you'll hear from today. First up, I would like to introduce Cami Wade. Cami serves as RN Clinical Care Coordinator for the Value-Based Care Team at the Texas A&M Rural and Community Health Institute. With nearly 20 years of nursing experience, most of her career has been spent working with rural health populations to provide competent team-based professional care, education, and support. She has extensive experience piloting and implementing value-based care processes, including Medicare Annual Wellness Visits and chronic care management, and helped develop the tools and documentation for those programs that support organizational goals. This work shaped her commitment to patient-centered, team-based care and reflects her passion for connecting with others and making a meaningful difference. Also speaking today is Crystal Stewart. With over 20 years of diverse experience in healthcare, Crystal has a strong foundation in patient care, medical coordination, and quality improvement initiatives. Crystal began her career as a certified medical assistant in a family practice in behavioral health, building a strong foundation in patient care and clinical operations. She later advanced into leadership roles, including team lead for an FQHC care coordination program, where she supported quality measure compliance, pre-visit planning, Medicare wellness visits, and improved patient outcomes through interdisciplinary collaboration. She also served for several years as a vaccine coordinator, overseeing immunization programs, ensuring guideline compliance, and advancing community vaccination efforts. And last but certainly not least, we have Grace Johnson. Grace serves as a Medicare Annual Wellness Visit Coordinator with Goodall Witcher and has been with them for over 9 years. During that time, she's developed a deep appreciation for rural healthcare and is passionate about supporting others and strengthening the communities she serves while enjoying time outside of work, creating lasting memories with her precious family. So I welcome all three of you today, and I think Cami and Crystal are up first, so I'm going to turn it over to you guys.
All right. Thank you so much, Cassidy, for that introduction. We're happy to be here and share the things that we've learned in the process with you all. So let me go ahead and share my screen. Give me just a second here. Got to find the right one to share. All right. Can you see that or no?
Not yet. Okay, I think we're getting it.
Are we there now?
Yeah.
Okay. So gotta figure out how to make it go forward. There we go. So Crystal and I also have another teammate, Yvonne, who is also an MA and works with us, and just wanted to, there's the three of us.
We all know that in healthcare, there is a lot of challenges in implementing different processes and procedures. It could be difficult due to turnover, not enough time, lack of funding, gaps in knowledge. There's plenty of reasons change can be hard in implementing in clinic settings.
So there are several different pieces to the value-based care, which Cassidy kind of touched on. Not just the annual wellness visits, but chronic care management and transitional care management, as well as quality measures. But the easiest place to start that we have found is just to begin with the annual wellness visits. because a lot of information can be gathered during those visits and can lead to the other initiatives once we have a foundation. And so that's why we chose to start there, to get a better accurate picture of the population. And then we can decide who is more appropriate for further case management or other issues. So everybody hears about these Medicare wellness visits, and why do we do them? What are the benefits? Basically, it's all about proactive primary care as opposed to reactive and waiting for these patients to have some kind of a crisis or illness or hospitalization. And by being proactive, we can decrease the health costs and the resources utilized to care for these people and reduce that inpatient and ED utilization. And overall, we're just out to have a healthier community, regardless of which community it is. I think that's the whole point and premise of healthcare organizations, is to help make their specific communities healthier and happier. So these visits have a higher success rate of early detection during all these proactive preventive screenings like cancer screenings, cognitive assessments, labs, fall and safety. And all of that, if it's earlier detection, leads to better patient outcomes. Once things can be treated sooner, usually it's easier to catch them before they get too out of control. It also helps with improved patient engagement. Patients actually like these visits once they get into them because they feel heard and they get to tell a little bit about not just what hurts or what's wrong with their body, but more about who they are and the other circumstances in their life that may be contributing to their health. It offers opportunities for the providers to get to know those patients a little bit better and be able to counsel on different things that may be a higher risk that they didn't know. And a lot of that can be done through those social determinants of health assessments, finding out more about those patients. And ultimately, it just enhances the entire quality of care, giving a holistic assessment, and enhances the teamwork within the whole community and the health system, and helps identify those care gaps and close those quality measures as well.
Our team of three was created around January, February of 2025. We have 6 cohorts that were part of or 6 clinics that were part of our first cohort that we worked with. And we have some numbers on the next slide that we'll go over with you guys, but we were able to work with them for a full year, and we are now working on our second cohort. So for our first cohort, there was about 4,900 attributed lives that we contacted. We scheduled and completed over 2,000 annual wellness visits. So it was about a 40% overall AWV rate. And the prior year, this cohort was around 8%. The average scheduling rate was 41%, and there's an 88% attendance rate for these visits. So we did really well getting these patients in for these preventative visits.
And I think the average national scheduling rate is closer to 20%. So a lot of clinics come and ask us, what our rate is in scheduling because they have a difficult time in scheduling those patients. But we've found that it's all in the wording. So the challenges in implementing the annual wellness visit in any organization are pretty similar across the board. There is a misconception of what this annual wellness visit is. Not just the patients, but also the clinicians. The patients don't fully understand that this is not a physical exam. And so education is the biggest component to combat that. There's also concerns about the time and documentation burdens in the clinical setting. It takes a lot of work to get these done. There's a lot of information that's gathered, and it has to be documented in specific places so that it's captured appropriately. And it takes a lot of time. And the patients, some of them, maybe they haven't talked to anybody in a week. And so they're going to share every single thing about their life for the last month. As you ask even just one question that's a yes or no question, they're going to open up and share. So it does take a lot of time. And if you want to, do it right and make the patient feel comfortable, then you do take that time and make them feel heard so that it is a benefit to them. Another issue is fragmented tools, such as the EHRs. There's all different types of EHRs. Some of them have templates built in, some of them don't. Some people, they're using paper processes. There's lots of different stuff, and trying to figure out what works best for each specific organization can be a challenge. There's also a lot of turnover in the medical field, unfortunately, people moving from position to position or from place to place. And so it's difficult to train somebody and put in the effort to do all that and then have them leave and have to start over. So that is a challenge as well. But I think the biggest challenge among them all is our human resistance to change. And I think all of us have that. And it's just it takes a little bit, but again, it all goes back to education and remembering why we do what we do. So when we're doing these annual wellness visit, we want to get the maximum value, the biggest bang for our buck, right? So the best practice is to use a team-based model, so that not one person is doing all of the work, but it's shared amongst the team. Implementing EHR tools and templates for efficiency, whether that's creating templates or finding templates that already exist within the EHR that you didn't know about before, or other tools. Incorporating that SDOH assessment, like I mentioned, is super important, because if you don't understand the context of the patient, you can't understand their challenges and why they do the things that they do for their health or don't do. If somebody is not housed, then trying to understand why their diet is so poor and their A1C is so high is going to be a lot more difficult than if you don't know that they don't have a refrigerator, they don't have access to fresh foods and vegetables, and so they can't change their diet appropriately. And so you have to work with that and figure out how to make those changes and make those counseling recommendations for them, as well as offering resources. It also helps with us addressing those risk adjustment factors, the RAF scores, making sure those gaps are closed so that we're getting the best reimbursement for our patients, as well as our quality measure gap closure, and making sure that we are hitting all of those quality measures. So again, the best practice is a team-based, patient-centered care approach. And I just love this graphic because it really does show how many people are involved, and ultimately the patient is at the center. And so I, started thinking, well, what if holistic care did not just refer to a patient and everything about them, but the whole care team, with them as the center focus? And that just made more sense to me. And it really is, it does take a team. It takes everybody doing their part to really get the optimal outcome and organizational viability.
So with the team-based approach, we have at the annual wellness visit, the workflow is different for each of our clinics that we worked with. We're all remote, so we worked with each of the different ones, and we most of the time we did a lot of the scheduling because that was one of the difficult things for the clinics to get enough people scheduled for annual wellness visits. So some we would do the scheduling, some clinics we did scheduling and all of the pre-visit work, plus all of the prepping of the chart. It just depended really on what each clinic needed. But we worked with each one to figure out what would work best for them. We involved the front office, the providers, just different areas. We made a workflow that would help the patient, help the clinic and our process work. The pre-visit planning, we try to do 7 to 10 days prior to the appointment. Each clinic did it differently. Some clinics would send out the packet of questions that is required by Medicare. Some we would call over the phone. Some would come into the clinic if they were unable to hear over the phone or any other reason why they didn't know how to work their smartphones. Anything we try to work with the patient as well as the clinic to be able to get that pre-visit planning done in time and get it uploaded into the EMR so that it saves time for the clinic staff and for the providers.
So the keys that we found to make this a successful program is basically that we are an extension of the clinic staff. And so we would always just say that we are with this clinic or with this provider. And we have extensions on our phones or computers, phone apps, whatever we are using, that reflect that we are from there. And that really makes a huge difference. The patients feel more comfortable. And we know some of the people obviously in the clinic that we've been working with. And so we can talk about, yes, I'm not sure, but let me ask so and so, who they're more familiar with. And then they are put at ease. We just keep an ongoing relationship with everybody in the clinic, from the scheduling to the clinic staff to the providers, whoever we need to be talking with. We try to keep that relationship going with weekly meetings, or if as needed, we can bump them out as we get more used to working with each other. And we always have conversations going on Teams threads, so that if there's an immediate issue, we can reach out to one another and address it as quickly as possible. Providing support to the clinic care coordinator. Usually these clinics have a care coordinator within their organization, and so we are coming alongside them to help support them and work with them as boots on the ground, as we're teaching and helping them to decide what is right for their organization. We are right there with our sleeves rolled up and doing the work with them. We also have been helping with oversight of the process and outcomes. So keeping track of what patients may have canceled, or there was any kind of an issue, whether or not they were completed, the claims went through, and they were paid. So all the way through each step, not just the outreach, but all the way through the end, as well as making sure that they do complete those preventive screenings that were ordered at those visits. So their mammograms, their colonoscopies, that kind of thing, making sure that we close the loop. And this is all in full alignment with the Torch CIN, which is who we partner with, and trying to just decrease the competing priorities. And basically just want to maintain the focus and priority of the goals and not get pulled in other directions, but just really focus on the annual wellness visit, making sure it is done to the highest quality and best practices so that they can reach their goals.
Having a dedicated person doing like the scheduling and the pre-visit planning is what has worked well for all of our clinics that we have worked with. Determining who's going to be a backup in case someone is out on vacation or sick. You never know what's going to happen. So if someone in the clinic that we were working with was out, we were able to step in and, make sure the work continues, or vice versa, our team of three. If one of us were out, we were able to help each other. Involving the entire care team from the front office, the providers, the billers and coding department, everyone involved helps make this process successful. We are going to hear now from Grace Johnson. She is from one of the cohorts that we have worked with.
Grace, can you hear us? I believe she's on. I just don't see her name, so I think she might be under a different name. Grace, if you're speaking, we cannot hear you. Okay, I got a message.
She's trying, Cassidy.
Okay, no problem. That's just fine. We'll give her just a moment. This would be a good opportunity if you have a question for Cami or Crystal and you want to go ahead and unmute or drop that into the chat. You could do that now, and we won't. We'll just take advantage of every minute that we have today. I don't see any questions coming through the chat. Oh, I do. We have a question that says, how do we enlist your help? And I'll let you guys go ahead and address that, and then I will say a couple of things. Well, okay, I will go ahead and address that. If you are interested in getting help from the value-based care team at the Rural and Community Health Institute, we will share our contact information with you at the end of the presentation after Grace speaks, and make sure that you have all of the connection information that you need to reach out to Cami and Crystal. And I know Rayanne Davis, the director of the value-based care program, is on the call today. So we'll make sure you have all of their contact information. That way you can reach out and see if this would be a good fit for you and talk to them. Yeah, you're welcome. Any other questions while we wait?
Cassidy, it says she said she's logging in on her computer. She was logged in on her phone.
Okay, no problem. She is, I'm sure, in the hospital today and doing a million other things. So we just appreciate her time and her willingness to join us.
So just one more thing I can add while we're waiting. As far as the team-based approach, it's just a analogy that I love to share with folks is the whole is greater than the sum of its parts. And I heard that I don't know how many times in school. I don't know about you guys, but and that can be illustrated by the fact that a Belgium draft horse, right? We in the medical field can be maybe likened to workhorses, right? We do a lot. Belgian draft horses can pull up to 8,000 pounds individually. When you put two together, you would expect them to pull 16,000 pounds. But in fact, they can pull 24,000 pounds, or 3 times what a single person or a single horse can do by itself. And if those horses are trained together and work together routinely, which we all do in the medical field, then their pulling capacity can reach up to 32,000 pounds, or 4 times what the individual can accomplish. And so just think what we can accomplish together if we work together, we train together, and have a common goal.
Rayanne Davis is going to speak on some of the work that we did with Grace's clinic since she's having some difficulty logging on.
Yes, I'll go ahead and chime in. We can start discussing the program that Grace supported at Goodall Witcher, as well as Carrie. I know she's on too, so feel free to chime in and we'll go ahead and kick it off on this portion of the presentation. I know we'll miss something and not do it justice like Grace, but I think it's worth sharing regardless. They did a fantastic job, had a great idea. Really, this stemmed from provider availability and access. So I think another struggle when we start to think about wellness visits is, do we have enough time on the calendar to fit these patients in and the amount of patients that are needed? And I think, Grace, are you there?
Yes, can y'all hear me? Okay. Whew, thank God. Okay, great. So sorry for the technical difficulties, everyone. Okay. Let's see. Okay, let me share my screen with everyone. Thank you guys for buffing that. Let's see. I'm trying to, oh, okay, I got it. Okay, so kind of like what Rayanne was saying, we knew that we had, of course, a ton of measures to meet with the Medicare Annual Wellness Visit. And so with working with Texas A&M, they were able to show us, let me do this right here. That way it looks better for y'all. Okay, hopefully y'all can all see that. So Carrie and I were really just trying to figure out a way for how we could just knock out a lot of these visits with one sort of go. And so we thought of the idea to do a health fair. And so this presentation is what we did on our health fair. So I'm going to run through this pretty quickly, but at the end of this visit or this meeting, if you guys have questions, if you guys would like this presentation, please let me know. You're welcome to email me, reach out, however. I'm happy to answer any questions. So just, you guys, I'm not sure what hospitals or clinics you guys are with, but this is who we're with. It's obviously Goodall Witcher. We are a critical access hospital. We are smaller. We're in rural Bosque County, so a lot of our population, a lot of them are a little bit older, and so a lot of them are due for their Medicare visits. So this is a little bit about us. I'm not sure if y'all have the same type of clinic or not. So we started out trying to figure out what was the problem with, why are we not meeting these measures? Is it our patients? Is it our staff? Is it our providers? And then we had to figure out the solution, the results. And at the end, I will tell you how you can bring this sort of model to your community if it works for you. So originally, we had to really figure out, okay, why are we not meeting these measures? And a lot of our patients really just didn't understand. They didn't understand the difference between the Medicare Annual Wellness Visit versus just their traditional annual visit. So we had to really educate our patients, and we just had really low rates. And so our providers also didn't really understand the difference between the two either. And so we really had to educate them as well. So with those things, we had to set some goals. Of course, obviously we wanted to increase our rate. We started out very, very low. And then as you'll see, as I go on with the help of Texas A&M, they helped us lay the foundation for what these visits require, and what you had to do really to complete it. Because if you're missing one aspect, then it's not completed. So we wanted to do all of these different things here. And then this model here, as you'll see on the bottom, these little bubbles that are pointing to each other, this is how we did our very first health fair. We had patients going through steps sort of like they do in the clinic. In the clinic, you know, your patients come in, they check in, they usually see a nurse or a medical assistant, and then they see the doctor, and then they might check out, or, you know, and then they leave. So we really had to make sure that we planned it correctly to meet HIPAA guidelines and regulations, to differentiate the two, and to also make sure that if we're going to bring all of our patients out to this whole other area, that we, you know, that we had things done correctly, that things were organized. So we decided to have a health fair at one of our local places in Clifton, which is our Clifton Civic Center. It's a place that everybody knows. So if you decide at the end of this to do this, we highly encourage you to pick a place that can fit a lot of people, but that people know in your town or city. We also had to make sure that we partnered with our community. We have other people that do health fairs, and so we wanted to make sure that we you know, didn't step on anybody's toes. We wanted to make sure that the community also understood, you know, what we were doing and the benefit of it. And then, of course, the logistics. You have to staff this health fair. So we did this pretty strategically. We had it on a Thursday during the week. We did it strategically for a couple of reasons. One, just because we didn't want to have, you know, we didn't want our people to have to work overtime, of course. And then also, two of our providers are they're our high volume providers, so they see a lot of patients every day. And so fitting these visits in for them on their regular routine clinic day was really difficult. They just didn't have the time on their schedule to have these visits done. And so that was also why we did it on the day of the week. It was just better for our providers to do it that day. And so our workflow is we usually will schedule our patients, and then we actually like schedule them for specific slots on this day. So the patient knew the day and time that they had an appointment at the health fair. So that really helped as well, because people weren't just coming and going, you know, sort of as they wanted. Now, we did have people from the community come as well, but we scheduled them. And so we also were able to sort of control the volume of people coming in and out. And then we mailed out our packets. So Texas A&M, they helped us make a packet with all of the requirements that Medicare says is needed. And so they asked some really great questions about their health, about their mental status, about, you know, are they exercising? Do they have access to, you know, to different things? And so it was really helpful, because this one packet itself, you know, completed a lot of the checklists that we need to for these visits. And also it helps us, you know, of course, with our patients. We also implemented marketing. You know, you have to make sure people know that this is happening. But like I said, with scheduling patients, they already knew that they had a visit. You know, they knew, so they knew to plan. They knew they were coming. We sent out letters with the packet saying, you know, this is for everybody. This isn't just for you. Everybody is welcome. And then, of course, the event day. And so on the right, you'll see stations. I'm not gonna dive too far into the stations, but this is what we use that worked for us. And then in Texas A&M, they were there too, and they helped us as well. They helped, you know, walk patients around as we needed. They even helped check in. Tammy even helped with medication reviews. And so with having them, we didn't have to hire any additional staff to do this at all. I mean, we were able to do it with all of our people already here in the clinic. So moving to the next one. So why was it a success? So these numbers where it says program impact, this is actually, I believe it's 50% now. This is actually this is an old presentation. We fixed it and everything, but I just didn't have access, so please excuse it. So we, of course, our goals, we want to increase the rate. We started with 15%. And so after having the health fair, after getting everybody to understand the difference of the two and all of those good things, you know, our rate more than doubled. Both of our providers, we had two providers that did this visit. They they both went up. We were able to strengthen this visit with our patients and also with our providers. You guys might have some providers that don't want to do this visit, and we had that too. It was a struggle at first, but once we were able to explain and find a good system and a good flow, it really adhered really well to it. We just had to be pretty consistent with everything. So let's see. We, of course, one of the goals is just to reach our underserved Medicare patients. Living in a rural population, a lot of our patients are just not, they're not connected like a lot of the younger population is. They don't, have cell phones, and if they do, they're not on Facebook and all the things. So we really wanted to make sure that we were able to reach them and engage to them. And by doing a health fair and by marketing this health fair and word of mouth, our first attendance rate, as you can see, was 80%, which, that is good, of course. But after the first health fair, we had 95% attendance for this. Now, I know, we did schedule these people, of course, but they showed up, and I'm sure many times there are patients that don't show up to their appointments all the time. So to have that high of a attendance rate was really great, and it made us, realize like, okay, this is working for us in our community. But educating your patients and your staff and your providers, it does fall hand in hand. We once again just had lots of confusion between the Medicare Annual Wellness Visit and just their regular annual. And so we had marketing at our first health fair, and they were able to do a video, and they were able to put that out on social media. And while I know some of our patients don't have social media, it is word of mouth. And so that just helps spread the word even more. So if you guys have anything like that, any sort of marketing, that was very helpful as well to get the word out. Okay. So once again, we did this. We consider it is a health fair. We consider the Civic Center in Clifton. We really considered it like an extension of the clinic. We had HIPAA forms. We made sure that we maintained patient privacy. We really did everything that we would do here at the health fair. So although it was off-site, because we're rural, we were able to make it work. So by differentiating the space between patients coming here to the clinic to their usual room with their provider, it really allowed the providers to have really great conversations with the patients. And it worked so well. It really did. And then we wanted to create a scalable workflow. So Carrie, she was able to create a template in Cerner that hit all of the different measures that we're supposed to hit. And so that made it very simple, and it's one thing across the board now. Whereas before, our providers were doing their notes, as they were used to. And so by providing this workflow, it really helped standardize it across the board. And it created really a scalable workflow because we didn't have one before. So having a health fair really helps with all of that too. So this is a graph for all of you that are visual like me. We got this data from Wellvana, but this also is important to say that this 37.1% should be 50%. So just excuse me for that. But once again, we really did increase our rates. We more than tripled it, honestly. And it was really great. And I do want to point out, I know there's a huge increase at the end of the year, and that was, we did that strategically. And we started our first health fair in September, and that's sort of like right ahead of flu season. So we also offered like vaccines and those sorts of things at this health fair as well. And then we did it also in December, just to sort of catch any missed patients, any missed measures. And so we really were strategic to make sure that we did these, far enough apart to where we weren't, doubling up on any patients, but also to where the word of mouth had spread already. And we also have health fairs around this time of year anyways in Clifton. And so we knew that health fairs had been successful this time of year anyways, which is why we planned them strategically those months. But we, as you can see, had a great increase. And then just sort of to wrap up a little bit, I know I've gone through this super fast, but it really does, we learned a lot of lessons on the way. And I know this says QR code here. I had the QR code. I just couldn't load it in time. If you guys would like it, I'm happy to send it. But so doing anything new, there's always things that you have to learn. Your setting really does matter. If you are in any sort of area similar to ours, you have to pick a place. You don't have to, but picking a place that is familiar to everybody really helps, because you're not having to give people directions. People know where it's at. Teamwork really does make the dream work. We enlisted, not only the help of people in our clinic, but people in the hospital side, and then Texas A&M was a great resource as well. Like Tammy and Crystal said earlier, everything that they said is true. Like, they help with the workflow. They help with every question that you might have, they help with. I can't tell you how many times I messaged them on Teams with just these little questions I had no idea. So if you have people that help, I would definitely utilize them, or, identifying someone in your facility that can sort of spearhead it, and just sort of make it happen. And then standardize your starter template, like Carrie did. That helps things because it standardizes it across the board for all of our providers. So there's no questions. It's just this template. This is the template that they use. We also were given a pocket guide from Wilvana, I believe, with certain codes. And so we gave that to our providers, but we also created our own with different G codes on it, just so that they have it hand in hand if they need it. And then if you guys have any people in your clinic or hospital that are, if you have a social worker, if you have radiology, any of these people here that y'all can think of, if y'all can have them there at your health fair to go ahead and schedule, your patient's mammograms, or schedule their colonoscopies, and go ahead and get them scheduled the exact same day before they even leave the health fair, 9 times out of 10, they're going to do it because they're already scheduled. We also just, at Goodall Witcher, the motto of Goodall Witcher is "We're here because you're here." So we really want to make sure that you put your patients before problems. If you can find a way to solve your problem, but also almost enlist the help of your patient, really understand what does your patient need, how will your patient, show up to these appointments, what do they need to feel seen and heard and included in their visits. That's really going to help as well with meeting these measures. I think that's it. Oh, this is the last one. So sorry, everyone. This is just feedback from our health fair. The first one, of course, our first feedback, 92% of people preferred it, which is still a great number. But our second one, 100% of people that completed our feedback, they preferred it. So this is just a couple of little things. Both of our providers said that this is a great visit. It created space for real dialogue, not just check boxes. And then these are patients as well that that said on the survey, said that they loved coming to it and turned their health into a conversation, not just an appointment. So it helps our patients as well, which is the point. Okay, that's it for sure now. Thank you.
Thank you, Grace. Okay, I'm going to pop over to the chat box because we do have a couple of questions and comments. And I just want to say again that we will be sharing the slides and the presentation recording with you if you'll give us a couple of days to get that out. The first question in the chat is, how do you make sure they haven't already had a Medicare Annual Wellness Visit billed from another provider? And then someone did drop a resource in, and then commented, you can also check visit history visit history in the patient summary to see what other providers the patient sees, and the main ICD-10 code for the providers that they've billed in the visit. So I don't know if anyone wants to add anything to that question and comment.
We do check something well, it used to be called Inovalon here. We just recently changed to another platform. But we get our list from Wellvana first, and I'm not sure if you're getting the list from there. But that's what we get at first, and then we double check it as well, because we have scheduled patients, and then it's time for their visit, and we look, and then lo and behold, a month ago a provider billed a G code for that visit that they were at. So I would just check on whatever platform you have, whatever insurance platform you have, to see if they're due for it, and then also educating your providers when to drop that G code and when to not, or the ICD or whatever code it is, when to drop it, and then educating them that if they do drop that code for whatever visit, that their patient will be ineligible for another year for their actual Medicare Annual Wellness Visit. So just keeping that in mind too.
Thanks, Grace. And then another question. Do you have a template office staff can use explaining what is and what can be covered within the visit?
We do, yes. I can send all of the information I have to, if you want to, you, and then you can disperse it if you want, Cassidy. That way we're not, I don't want to, step on any toes. But yeah, I can send you everything that we have. We also just, speaking with your providers face to face, we realized that really worked well for us. I'm not sure how your providers are, or if you have that sort of relationship with them, but we were able to talk to them and have a really personal conversation and saying, this is what they're requiring. What do you think about this workflow? Yes, we have a template.
Yeah, that would be great. Thank you. Next question. To clarify the year, is it exact to the date or 11 months between?
I don't think it's exactly to the date. I think it's a month. So if they had it in January, I think it's a January, but I'm not 100% sure.
Okay.
I may be wrong, Cassidy, but I think it has to be more than 12 months.
Okay.
If it's 11 months and 29 days, it won't count. That was my understanding when I was a clinical practitioner.
Great. Thank you, Dr. Parsi. Next question is, what kind of community partner, Grace, this is for you. What kind of community partners did you have at the health fair, and was it beneficial?
Yes, it was. Yes, thank you, Rand, for that question. We had enlisted the help of our home health providers. We also we enlisted like the what is that called? I'm blanking on it now. We enlisted our home health. We also brought in a couple of skilled nursing facilities. We also had all of our people here as well. I know you said community, but we had all of our, radiology. We had our behavioral health department coming. We offered vaccines. We also had like a Cologuard come. And then we also had, it's not DEXA. I can't think of who it is, but we had another person come that helped with the implants to monitor blood sugar. I'm blanking on the name right now, but as many people that you can think of for the visits, anything that they have to meet, that they have to schedule for, if you can have people there, that's usually going to help. And it was beneficial. We actually had a patient that you could tell that they needed some help at home. They were struggling with their activities of daily living. And so by having them there, they were able to talk to one of our home health providers in the community and get help that same day, just because they were face to face.
Great. Thank you so much, Grace. Any other questions? I know Grace has a hard stop for another meeting, but we still do have a few minutes if anyone has questions for her or Cami or Crystal. I also will, follow-up question. With so many patients, how do the providers document and chart?
We implemented a template across the board for the providers. Carrie was able to create that template with all of the measures and marks, and she created it specifically for, like their initial or their subsequent or whichever visit they were having, so they could do that as well. And so, and then I forgot to tell you guys, we did with Texas A&M, they created a prep sheet for us, and we modified it for what we needed to work best for us. But This prep sheet has everything that Medicare says they need, their colonoscopies, their labs, their immunizations, do they drink, do they smoke, all those things. So by putting that all on one paper, they just hand it to the doctor, and the doctor looks at it, and if there's something that the patient needs, it's super simple. Once they do it a few times, they really got the hang of it. But that's how they did it. Yes, I'm happy to share. Yeah, it'll be all in that information.
Thank you, Grace. Another question: how many patients did you schedule per health fair, and what did the time slots look like?
The first health fair time slots, we actually schedule them for 5-minute time slots. That doesn't sound like a lot of time, I know, but we had patients had stations to go to, so they were never waiting like they have to do here in clinic. They were just going from station to station. Oh, sorry. And so we scheduled them for 5 minutes. Our first health fair we scheduled 40 our first health fair between the hours of, I think we did 8 to 3. And we noticed that by having it a little bit later in the afternoon, a lot of our patients, they kind of just stopped showing up after like 1. So our next health fair we scheduled 60 of them between the 2 providers, and we scheduled it between 9 and 2. And so by creating a shorter time frame, all your patients show up, and by having so many different stations, patients aren't waiting. And if they have to wait, they can go to the vendors and go get all the things that vendors have to offer.
Excellent, thank you. I believe that is it, but we do still have a few minutes, so if you think of something, please go ahead and drop your questions into the chat. I am sharing in chat the email address for Rayanne Davis, who is the director of the value-based care program at the Texas A&M Rural and Community Health Institute. So for anyone that's interested in reaching out about whether or not this is some support that you would be eligible for, or if you're interested in more information, she would be the perfect person to reach out to and have questions for. So I've included that in the chat right now. And let me go back and make sure we haven't missed anyone. Yes, we will make the recording available as well as the slides. So you can check your email. That'll come from Archie, RCHI at tamu.edu. Probably tomorrow, just so we are able to gather all of the content for you guys from the speakers. You're welcome. All right, any other questions? Any final thoughts from any of our speakers today? Okay, well, then if that's all we have, we will go ahead and dismiss a few minutes early, but we thank you for your time. One more thing, you guys, that I don't want to forget to do is launch this poll. If you have just a moment, it helps us with future webinars and just making sure that we're providing the content that you're interested in. So we would appreciate that. But we thank you for your time, and please reach out if we can do anything for you or provide any more information. And as always, we are grateful for the work that you're doing in rural health and look forward to seeing you next month. Thanks, everyone. And thank you so much, Grace and Cammie and Crystal and Rayanne.
Thank you.
Thank you.